Dindi miamayire or store mwedinija me yire ensori anopa enkase na nia ha anase no hoye ne mreda sanam papa ne mfia konkan ono so nkompreni da tede ho babia ne ya osori anopa na no afanse kan okonefu me akrobeto madwuma meye me kan news na me acte na me kobeba tabiara no ebere me de bedampo na adiase nanso me nsori da krokra nkase me ho babia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa me shakurani eyaduru a onomu a ebo ni padua no ema pi usita me kanfo ama o se wonso no no kowa mesani bi na babua na aboa no abusua na yareda ho eya nunum bi na obedi adanse ubenya bi ato obebi eton. Telephone number
0591 565 778 0509 876 891 and 0547 641 310. So wo pe kwa mixture ato ewa America brochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adodona Freno Agenda, it was 0773-610-1112.
Kowa mesha abusua amintas
FDA ahwehwe edwadie nkratoyi yi agiatum se eye.
Yo, yes, I'm a more bio about ARHWS. So I health and wellness. I'm also good. So I'm I am also from Kwame Manu. I do Sunday say from 10 to 12 Chicago time. You know the energy say I promoting some corn the barbecan and then Rosemont now you need the Dujuma and free Hana Ojaya Muko Canada. Say ya do more Kwaku Fana Sad Naba and Sad Naba. Then they ever come once a Dutrum cry sexually transmitted infections and diseases. Just a agro and then call a friend to call a friend. Say, had the one show no yaba. Yes, now it means that you are buying on your coupons is our boy who buying throughout the weekend and or her and so or the alcohol the yaba and she said then I see baby and of course viewers and listeners Munu and Kenny. More hunting yes so why to me the Abramo and then no some the kind of Rosemont no tamano and the net tree na kakra but say o call Canada idiot say nene kasa tree no wa ya no abona mpese kura de amao enti but you ever heard enti yenya Rose that is saying
Ayo, na mtu
Nyamiadom boko. So what's your time? I'm gonna say, flow ebe flow. You ever heard it this week? And I ever who?
You be sure.
All right. Now I'm bomb to say.
Me pacha pomie.
A pomie, good. A pomie. All right, and so you better go for commercial break, right? You buy one and then we just jump right into it. And so you call commercial break. You buy and you buy to us. And you stay with us.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
also one more pig. JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.
World Remit, a better way to send money.
Wow! Me pa na fi ma file me tax including dia kwa mami. Na ene se afe no kwa wiye me tax file na beye me asompidie ene nkwada na. Nanso with Acronym and Associates say die menyo butantim e me tax issues ahodi nyina mu. Onua wow anything e was file or tax with smile. IRS for editable atoso. Wo mu hunehuna, wo mu tata, wo file or tax a. Da bia da uboka. Usika unya ekitu ebi. Make no mistake. Fahobo Acronym and Associates. With Acronym and Associates, what tax filing ebedano S gracia ubeji boom, no problem with IRS. Yes, for your experts, what individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing, and in some Acronym and Associates. State BR Iowa America, Kroponimono, Mepacho, Womu Ewo, GDA, Anamon Quine, Pasua, Wombetime True, Akoshem Quan, Ewo, tax filing. Ain't baby Bia Ubia. Utimi any Acronym and Associates etokese. Najuma Dian Obonti, Acronym and Associates, a deal Bia the friends Ura gender, not just a Wakudarimu, Aben, Ewo tax filing. Fawobedan Womo, Shishawana Chi Quine, Ewo offices, Audua, Edisway. First location 684 West Boughton Road, Suite 201, Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchaf Wanum Ewo. Telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-247-3454. I feel bit my email no ewo acronym.info@gmail.com. Acronym and Associates, yes, nukrenie open kunim die ewo tax mudia. This auto kese with Acronym and Associates. ANG nkwa.
Minia ba eni ma medufi oye dwuma odukasi anopa biara minia ba sori ahoɔden mu na ɔkwadwuma on complaining da tell hu ba bitutu no sanso na mebra o efitani o tu engine na o pagya engine be ka adwuma sɛ de sitie da bi biara no ho dendenden mi amayire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanam papa ne mfia konkan ɔno nso complaining da tell hu ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de beda mpo na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a wonom a ebo ni padua no ema wo se pi usita me kanfo ama wo se won so no kowa mesani bi na baboa na aboa no abusua na yare da ho eya nunum bi na obedi adanse wo benya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. So wo pe kwa mixture ato ewa America brochi memu for One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonana Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadie nkratoyi agiatum se eye.
Yo, yes, I'm a bill at the bar radio. So said I'm a kind and any about Rosemont and I about better in Como. Now, Rose said, Dick, I can, I hope so was slides until me and Charon we just jump into it. Now, I will be another my.
Yo, that's it. Okay, so it's here for a mature Obia.
Yeah, also.
It's good to be back. Now, sir, of Aquaman, sir, now can sir, today, Abekasa every sexually transmitted infections and diseases more. So it's important, say, Yakasa every sad topic, no way. We have many assumptions about what it is, but it's important, say, Yahu, say, if we are at risk or not, and how we can protect ourselves and how we can prevent, exposure to these types of diseases and infections. So the first thing is we need to know what is it? What are sexually transmitted infections and diseases? So they're different from one another, but essentially what it is, it's a virus or a bacteria or even a protozoa, a fungus, whatever it is. It's an organism that is able to be transmitted from one person to the other through any form of sexual practice. And that is including sexual intercourse, that is including anal intercourse, that is including oral, any type of sexual practice where there's an exchange of bodily fluid. It can increase the risk of now having this organism or this type of virus, this pathogen going from one person to the other. So that's what essentially a sexually transmitted infection or a disease is. Now, the difference between when someone gets an infection versus when someone gets a disease is that first, usually people start off with an infection. So what that means is that there is a period of time where the after sexual intercourse, there is that exposure to this pathogen, this like a virus, so to say, that comes into the person. And for a period of time, it can then cause symptoms. And the symptoms, it's like you can have like an ulcer and we'll talk about the different types of symptoms that can happen. But that is the thing that happens first. That's the infection. Now, if it gets treated or if it doesn't get treated over time, when it starts to affect the whole body, that's where it now becomes a disease. So a lot of times the infections, if they're not treated soon, they can then become the disease. And so it's important that we always get treated as soon as we can. Also, the person that we are with also gets treated so that it doesn't eventually turn into a disease. Because when it becomes a disease, it's affecting the whole body and it's causing even impairment to our whole mortality, right? Our even it's affecting our quality of living as well as even our longevity, how long we live on earth. I'm sorry, I wasn't able to see that in tree. That one there, Ed.
I was starting and I will I consider was I can't.
I'm trying to say like time to time, maybe far words, no, maybe fra.
Yate. Fra kakaba. I think I'm considering what all can be on to.
Okay, so young Costas. So this one is what are the risk factors? What increases the chances that obi ebitumia ania sexually transmitted infection? Well, obviously the first one is if you are sexually involved with someone who has a known STI, a known infection, then of course it's going to increase the risk. So it's important before we're involved in any kind of sexual practice, we are knowing who we're with, to make sure that we are protecting ourselves. As well, too, usually we do see that there is an increased risk of people who are less than 30 are the ones who have an increased risk of having sexually transmitted infections. And that's because generally, they have multiple partners. Generally, that's the age where they're not necessarily in a committed single relationship. And so it does increase the risk. At the same time, too, one who has more than 2 sexual partners in a year also increases that risk as well. And then one of the most common things is that there's no form of barrier contraceptive, meaning there's no form of protection. And so usually when we ask people if they're having safe sex, what we mean is not just, so sometimes people think that safe sex only means, oh, I just pull out, really quickly. But that's not necessarily safe sex. That still increases the risk of having sexually transmitted infections. By safe sex, it means using a condom, or having even birth control is not even safe sex, but some form of barrier, a hindrance between your bodily fluids and the other person's bodily fluids. That's what safe sex involves. And when there is that, it does increase the risk of, or does decrease the risk of having sexually transmitted infections. So that's important. It also protects against HIV, hepatitis B, as well as chlamydia and gonorrhea. And then also another important thing is that sexually transmitted infections can not only come through sexual acts, but again, the main thing is that there's a shared fluid. By shared bodily fluid, it includes blood, it includes semen, it includes secretions. So even if someone injects, gets a dirty needle and injects themselves, that also increases the risk of having sexually transmitted infections. And then, of course, sexual workers and people who have been sexually assaulted, that also will increase the risk. So those are risk factors that we have to be mindful of to know who is more at risk and who isn't. And when we know the risk factors, and when we go to, your doctor, we can be able to ask for screenings. A lot of times where we practice right now, we ask patients about their sexual history. It's important. Sometimes they're very uncomfortable questions to ask. And at times, because they feel embarrassed, they feel shy. But it's important to know, it's important to also speak up for yourself if you are in increased risk or increased practices that can increase the likelihood of you being exposed to these types of infections. It's important to tell, say, we'll catch her with doctor, no, now on so. Then some screening and some testing can be done. Okay, so then what are some general symptoms? Will be ebetumiania. Said obetumia who say, okay, maybe me was an infection, no, or I don't. So some of them is generally it's genital. So genital meaning the vagina or the penis, and that comes with some type of discharge. Right, so more than the usual, there's discharge. It comes sometimes with an odor or a different color than what is usual. That's one way. The other one is burning sensation when it comes to peeing. So that is also another way for someone a bit to say maybe they have an infection. It's also very similar with something called the UTI or urinary tract infection. That one too, when they so that's another one. But these are all, when you put all the symptoms together, then it can help to know maybe what is likely to happen. Another thing is abdominal pain, stomach pain, especially the lower part of your abdomen or your stomach, testicular pain, rashes, and lesions, as well as wherever one practices sexual activity. Sometimes people it's not only through the vagina or the penis, but also the anus, and also your mouth as well too. So sometimes people can have ulcers or lesions in the mouth. Sometimes they don't even know what's happening, but that also can be one. And we'll later talk about even full body, when the full body, the nipadrino is affected by it. Did I say that right?
I know they all come some more. That's some people. God can tree and got the assembly. I'm going to say more Sayaka. Is it Ayaka? And Nanaba Savo can tank Janaba. Was number 4 so we can't hear anything. Nana, What the brony grow? At the Mr. Baba, the Arity, the Kakaka, or the Frafra. And so many more can or can you chunk behind it? Furukano, Yapa. But Obo body and all their friend can crank a crama. Rose is doing a big job. I will see you. I
So another one is also when the whole body is affected. So a fever, now or weight loss. I don't how do you say weight loss?
Swati.
Yeah, we'll swat it. Wounded, won't person wounded so. And around here, so yeah, well, you will be your neck, no, your friend a lymph nodes. Lymph nodes, part of our body now, it picks up a area. So sometimes these lymph nodes around our neck and armpits so and a groin area. It can then become swollen. So if you feel your neck, sometimes when you even have like a really severe type of cold, you can feel your neck. And a bit to me who say part of the neck no epija at home. So that's your lymph nodes being swollen. So sometimes that's also another indication said infection at abawu. And so it's important say who doctor no now we'll catch your almost say as soon as sad no a woman who so then some testing can be done so.
I know the Nana said and I only a question. I go see and I see a pay. Mupens Moshiapa, is it a carry a movie? You go for Brody Vitana betra. Let's continue.
Okay. So the first one you bet kasa every gonorrhea. Gonorrhea is a very common sexually transmitted infection. Now, gonorrhea, no, it's actually from a bacteria, your friend of Neisseria gonorrhea bacterium. So what it is a bacteria not able to either like through the penis or through the vagina. Now, usually in men, the kind of symptoms now a painful urination, say your casa efrimu, your friend of dysuria. So painful urination or who say penis no liquid no discharge from that place no it's either like a yellowish type of discharge that comes. So that as well too, it's a purulent one, so it's a lot of it can come. So that's another type of symptom. Usually this shouldn't be happening, so when you see it, it's definitely an alarm set. Okay, you need to go and get checked. Another one is that also it can also happen in females, but the interesting thing in females is that usually it's asymptomatic, which means that almost usually they don't really have symptoms. But when they do, similarly, they'll have burning urination as well too. And then also because it's asymptomatic or they don't have symptoms, then a lot of times they don't get treated. And if they don't get treated over time, one of the complications is one can have something called PID or pelvic inflammatory disease. Now, when this one because what it can cause is very, very painful, like a lower abdominal pain. So say like like it's discomforting. And it can also increase the risk of having infertility. So obi epe eba because over time they didn't get this treated. So that's something that's important. Sometimes people, they have a lot of sexual partners when they're young, and then finally they settle down, they get married, and all of a sudden they're realizing say to me and get pregnant. To me and so sometimes one of the causes when we do some more investigations, we see that they have PID. pelvic inflammatory disease that has happened when they were in, let's say, their early 20s or even in their late teens, that wasn't treated, and that's why it's happening. So it's important to get treated and to also be checked. And then the other thing is that gonorrhea, it likes a downfall, and usually it comes in connection with chlamydia. So it usually comes together. And so what one of the treatments is, usually when we're treating gonorrhea, then we're also treating for chlamydia because they like to come together. At least 50% of people can have both infections together.
Then we'll go through presentation. Questions already.
Okay. Woodia Fabra.
Question the questions are no whatever.
Yo.
Also, I can just say somehow can.
So how yɛbɛtumi ahu sɛ yɛwɔ saa adeɛ no ɛwɔ yɛn mu? Well, it's easy. It's through a quick diagnosis, which sometimes is through a swab. So the doctor no ɔbɛtumi ayɛ swab no that's one way. It's through a gram stain, or sometimes even through urination. They'll give you a cup, you just pee in it. Usually you want the fresh catch. So at least if you like wake up in the morning, you can give a urine sample, and or even if there's some discharge, then we can even culture that discharge as well too, and we take it under the microscope. And who says bacteria no. And the treatment again is just, it's a antibiotic called ceftriaxone, which is given to treat the gonorrhea. And if you, usually they'll also treat chlamydia in case you have both of them, which is through azithromycin. And it's a very easy, quick pill to take. And then usually that can be done within a matter of a week. And it's important to treat because it can be transmitted as well to if a pregnant woman, and if it's not treated, it can even affect the baby as well, cause even blindness in the eyes of the baby. So it's important that pregnant woman, she's treated. And even if she, let's say, is they find out later on in her pregnancy some infection, then for the child, if the child is being delivered through the vagina, then the child will also get an ointment to the eyes to protect the eyes. We see this. Recently, there was a case where a child had chlamydia to the eyes, and we had to treat them. And the baby, what happens is the baby has like mucus that keeps coming. The parent tries to wipe it, but still, it's a yellow kind of mucus that comes around the eyes very early when the child is like 5 days old. And so that is an indication that child could have had chlamydia or gonorrhea to the eyes. So chlamydia as well to say chlamydia. The other thing important about chlamydia is that chlamydia is the most common STI in North America. It's very, very prevalent. And so again, it has the same features. It's hard to know which one will be Enya because the symptoms are so similar between gonorrhea and chlamydia. So the way that we test it is through, like I said, through either urine or through a swab that's done either the vagina or the penis, or through the discharge that comes. And then again, we just treat it like we talked about here. And then also the management is that you want to also test the partner as well too, because like I said, the woman obano sometimes on nimsa onya. So if the man is coming saying that, doctor, no, every time then they'll ask about the sexual history. Maybe they were with someone for the first time, some new partner. Then they'll ask them to, if they know that partner, then they should also get tested as well too. And usually we don't always test for cure. Some places they do. Generally, it's not always needed. However, if a person is of the like a young age, then usually it's recommended that they get a test of cure, or if they're pregnant as well too, it's important that they get a test of cure. And what that means is after the treatment, we wait about 3 to 6 months to do another test. Yenhu biom se sa ya reno ewo system no ana ejono ama sa ya reno akọ every woman completely.
Yeah, go ahead.
Okay, so let's go to the next one. Okay, so yeah, this is the same thing na yakasa. Why is it important say yahun se sa ya reno every mumu completely? Because of one of the major complications, especially in women, which is called the PID, the pelvic inflammatory disease. And so again, it becomes much more serious because it affects the uterus, the organ now. When you get pregnant, the fetus or the baby grows in. And also it affects the fallopian tubes. Fallopian tubes is an important part of the uterus because it is where when the egg goes into in order for conception to happen. So sometimes one of the difficulties with pregnancy, someone getting pregnant, is there's that highway, if I may say, it's not available for the sperm to travel to get to the egg because the ducts or the tubes are blocked. And it's blocked because before, back in when they got exposed to the infection, it wasn't treated, and so it blocks the ducts. And so that's one of the reasons why sometimes for people it's hard to get pregnant. So these are some of the complications, and these show that it's important to get treated for these reasons. Another thing as well too is that it can also cause painful intercourse as well over time. So this is another sign of pelvic inflammatory disease. But let's jump to syphilis now, which is another sexually transmitted infection which can lead to disease. So surprisingly now it actually is increasing. There's a rise in cases of syphilis. Did you know that?
I did not know.
Yeah, syphilis.
Yeah,
but about back. Say coronavirus is taking over, but it's so we're seeing an increase in syphilis in North America, specifically even in places of indigenous populations. So places like where there's a lot of First Nations, it's a test that we have to do readily because, and even in also in prisons, places of imprisonment as well too, there's increased risk of it as well. And so with syphilis, it's a very interesting type of bacteria as well too. It's caused by something called Treponema pallidum, and there's 4 stages. Now, the reason why syphilis is important to catch early is because syphilis, when it first, it takes about 6 weeks from the time of, let's say, a sexual interaction till the time of the first symptom. So obi abetumi ania sex and who crass or nya sa yare no. Also, the primary type of syphilis, it's painless. It's a painless chancre that comes on the penis or around the vagina. And so what it is, a chancre, it's like an ulcer. So think about like if someone gets a burn on their skin and it causes an indentation or a mark, a kind of a mark on the skin that kind of goes deep into the beyond the first layer of the skin. That's a little bit of what happens with a chancre, but it's painless. So sometimes if you're not really careful, if you're not assessing yourself, because there's no pain associated with it. But if it's not treated, then it can develop into secondary syphilis, which is a more painful type of syphilis that happens and even affects more of the whole body as well too. So it's important that you also assess yourself and you get treated because it's an easy treatment. It's just penicillin, an old drug, an old antibiotic that has been out on the market for a very long time that is easy to treat. But again, if it's not treated, it can even have what we talked about earlier, systemic effects, where it can even affect the heart. It can even affect the brain. And there's a famous actor back in the day who actually died from syphilis because it wasn't treated. So it's important to also get treated. Syphilis, as well as gonorrhea, chlamydia, and even HIV, are standard treatments or standard screenings that are done when someone gets pregnant, just to make sure that it's not in the system of a woman who is pregnant, because it not only can affect her, but then it can affect the developing fetus and even cause severe effects to the child when they while they're in development, and even when they deliver as well too. So let's go to the next slide. So on the next slide, so like I said, it's important to also treat the child, and so that's why we do screenings ahead of time. Okay, so now the next sexually transmitted infection is herpes, and this one too is very prevalent as well. Herpes is about at least 12.1% of people who are ages 14 to 49 contract herpes, and it's one of those very bothersome type of sexually transmitted infection, because it can continue to keep coming and coming even after treatment. There's always, it can always cause another flare-up or another episode. Now, herpes can affect, there's several strains of herpes. There is herpes type 1, which is not necessarily transmitted through sexual contact. But herpes type 1 is the same thing as a cold sore that people can get on the lips, on the borders of the lips. That's herpes, but it's a non-sexually transmitted type of herpes. And people who have that, they can even tell you that, let's say every time they feel sick, and then they feel that another cold sore, they get it. Or when they get stressed out, when they get little sleep, when they feel feverish, they get that. So that's something. Herpes, it likes to stay in the nerves of the body. And so when there is any form of lowering of the immune system, then it reappears again, and then it shows itself again. So that's herpes type 1, which is above the waist. And then herpes type 2 is the one that is usually transmitted through sexual activity. And that is usually on the genital area. So on the penis or the vagina, the vulva area. And that is a painful type of ulcer or wart that can come. And this also needs to be treated as well too. Another type of herpes that happens is actually chickenpox. So herpes has different types of strains, as I was saying. And then you can even have chickenpox is considered another type of herpes. And even when chickenpox, this is another example of how herpes, generally the herpes virus acts, is that people who are exposed to chickenpox and who have chickenpox when they're young, let's say around 9-10 years old, later on when they get to 65 years or older, in their older years, they can then have a reemergence of that herpes, now called herpes zoster, which causes shingles. And it's a very, very painful rash that happens on one side of the body. It can happen even on the eyes, the ears, on the chest area, the back. So just even a side note, it's important that you get the vaccines against herpes. And even when you get older, make sure you talk to your doctor to get a vaccination called shingles. Shingrix is what usually the brand name is called. And these help to protect against the reemergence of these herpes, because they like to stay, almost like to hide in the nerves of the body. So what are some of the symptoms that can happen when someone gets herpes? Gingival stomatitis, what is that? It is when you can have ulcers of the mouth, as we talked about, also the genital type of warts. It can even affect the eyes as well too. And then there can be a general outbreak of herpes throughout the whole body as well too. And then in worst case scenarios, it can even affect the brain as well too. So it's very, very important to get treated. It's a simple treatment. It's with an antiviral type of treatment called acyclovir. And this helps as well to treat against it. Okay, so we're almost done here. And if you have any questions, you can let us know so we can answer it and make sure that you're able to get your concerns addressed when it comes to this topic. Another important sexually transmitted infection is genital warts. which is through something called HPV, or human papilloma virus. I don't know if people have heard about this before. It's a very popular type of sexually transmitted infection. Usually it's not harmful. There's a strain called that leads to warts. It's warts that can be found on the soles of the feet, as well as throughout the body, on the hands. This is usually due to this type of virus called HPV. And usually how it's treated is through cryotherapy. So what that means is that they take it's like they take a solution of nitrogen, cold type of solution, and they just apply it to where the wart is on the feet or on the hands. And usually when the strain is type 6 and 11, then it doesn't cause any cancer or any severe infections. However, HPV also has another strain that is very that is very dangerous, because it increases the risk of cancer. And this one, it increases the risk of what we call cervical cancer. And this is type 16 and 18. And what that causes is the cervical cancer. And it's important, I'll just share here, that's important for women to be checked with the routine pap smear. Pap smears help to ward against this type of cervical cancer that happens. Okay, and the vaccine that is used here is something called Gardasil. Usually it's given to children when they're in grade 7, so around 12 years old, they get this injection. And even when, let's say you came from Ghana or somewhere else, you came to North America at an older age, you can still get these injections, you can still get these vaccines to help protect against HPV. And it's still Gardasil that can be given to help against that. Well, let's go to the next one. Okay, so we're almost done here. One of the other key ones, it was very popular, as we know, and a lot of research has been done since the 80s, which is HIV. And HIV, as we know, one of the things, it's mainly caused through bodily exchanges, bodily fluids. And the primary type of infection with HIV is the fever, again, the lymph nodes that we talked about that are involved, and then also just a general tiredness. So it doesn't really have, if you're looking for HIV to come mostly through the genital area, either through burning, pain, burning urination, or warts or anything like that, it doesn't happen like that. It's usually a general type of infection that happens. Just people, they'll come and they say, I just don't feel well. I don't know why. Like I'm losing weight. That's usually the primary type of infection. It has a long incubation period. So a long time before it starts to, even after that, 4 to 7 years, before then a full-blown type of HIV infection happens. After that, if it's not treated, then it leads to AIDS. So AIDS is when the immune system is completely affected by it, and there is a significant lowering of the immune cells, so much so that now it is a full-blown AIDS. So people start off with the infection and then move into the AIDS, which is then the full-blown disease of it. And so this is the littlest type of infection, all of a sudden can actually increase the risk of someone dying. And they have an increased risk of even having several types of cancers as a result of this. And so the diagnosis is simple. It's through usually a screening type of test called an ELISA test. And if that is positive, then we move on to another test. So be ansano or be ebe from the doctor no say or nya AIDS or nya HIV. There's 2 confirmatory tests that will be done through the lab. So if someone says, "Oh, doctor, how do you know say no?" It's a very, very highly scrutinized type of test that is done before omobetumia katra sa adiano. And then the treatment is an antiretroviral medication that is done throughout the entire lifespan of the person's life. Nowadays, it used to be a cocktail. several medications that were given. Now we've been able to reduce it so much that it's just only, even now there's some on the market that is just a few drugs that is taken, but there is such a great response towards it that people are able to have a very, very fruitful and high quality life even after taking the medication for a long period of time. All right. So one other thing that's important to talk about when it comes to sexually transmitted infections is another thing called Trichomonas vaginalis. So this one typically affects women. And this one here also is through sexually transmitted infections. It causes itching and burning too. And again, as we talked about, the burning urination, that happens. And then usually males are not affected. But this one, it's important that also the men, the partners are treated for this as well. And there's usually a follow-up test that happens, usually 3 to 6 months for this. And then also we have some common causes of vaginal discharge that happens, but this one isn't necessarily, it's also increased through sexual activity, but not necessarily from sexual activity. And so that is something called BV, bacterial vaginosis, which has a very fishy odor, specifically in women, very uncomfortable, causing a lot of discomfort. And then there's also Candida, which is a yeast type of infection. All of these can easily be treated. The yeast is treated through, there's a over-the-counter medication called Canestin that usually helps to treat the Candida, which is the yeast infection. Another thing I want to just raise here is that yeast infections, they're typically higher in people who have diabetes, who their almost sugar is not controlled, because yeast likes sugar. And so it's important that if someone diabetes, it's important that they get treated, that their sugar is under control, because it can increase the risk of having the yeast infection, which is Candida here. And then lastly, we'll move on to the prevention. What are some preventions? As we talked about vaccinations, and we all know now with coronavirus and with this pandemic, how important vaccinations are. It's the same thing here. Vaccinations against hepatitis A and B, that's even another one. Just because this was so lengthy, I decided to minimize it to these types, but hepatitis is also another infection that is increased through sexual activities as well, especially A and B. As well as Gardasil is also another vaccine that's given to protect against HPV. Condom use as well, to male circumcision as well. There's something called PrEP, which is a prophylactic medication given. So what does that mean? Let's say you don't know who your sexual partner is. We talked about earlier at the start of this presentation, it's important the person that you're sleeping with. But let's say you don't know, but you know maybe they've engaged in a lot of sexual activity. There's a medication that it's called the PrEP, and it helps to protect against. So ansana you engage in sexual activity, you take this and it protects you against HIV. And this has been a very big game changer against reducing the amount of people contracting HIV, because they take it and it decreases the risk of now actually having HIV. So you take it twice, you take it one time, you take 2 pills before you engage in sexual activity, and then you take it just afterwards, and then you take another one about 34 hours later. And that helps to decrease the risk as well. And then the other thing is abstinence. Abstinence is the best way of practice against sexually transmitted infections, but also just decreasing the number of sexual partners that one has also decreases that risk as well too. Okay, so that
questions no dey bad that's what we so na enye kama ye kwa agwaje nkrato ye ba then we pull up the questions on you and then see how things go.
Okay.
Za mo kwa make abro for kwa me person make.
Wait, yeah, it's difficult to speak it. I say, yeah,
okay, Nana also, Adiana also, Mama na church mo e wo twa kire.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services as a foreign transmittal agency by the Massachusetts Division of Banks, number FT1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT1179663.
World Remit, a better way to send money.
Wow! Me pa na fi ma file me tax nkunimdia kwa mami. Na ene se afenu akwawiye me tax file na beye me asompidie ene nkwada na. Nanso with akunim and associates say die menyo butentim e me tax issues ahodi nyina mu. Onua wow anything e was how file or tax with smile. ARHWS for editable atoso. Womu hunehuna, womu tata, wo file or taxa. Dapia da uboka, usika unya ekitu ebi. Make no mistake. Fahobo Akunim and Associates. With Akunim and Associates, what tax filing ebedano S gracia ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support. Electronic filing of both federal and state filing. And NSM, Akunim and Associates. State BR Iowa American Kroponimono Mepacho Womu Ewo GDA Anamon Quine Pasua Wombetime True Akoshem Kwan Ewo tax filing. Ain't baby Bia Ubia Utimi any Akunim and Associates etokese na jumantia obonti Akunim and Associates e deal bia the friend say owura agenda na chese wakodare mu aben e tax filing fa wo bedan wo mo hwehwe wona chi kwan e offices ahodo a edidi suwe. First location 684 West Boughton Road, Suite 201, Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchafwanum Ewo. Telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-24 080-734-5454. After you beat my email no ewo akunim.info@gmail.com. Akunim and associate yes no krenie open kunim die ewo tax mudia. This what to kase with akunim and associate. Any G nkwa.
Ba eni ma medufi oye djuma odukisi anopa biara me nua ba sori ahoɔden mu na ɔkwadwuma on complain da sɛ ho ba bitutu no sanso na me bra o efitani o tu engine na o pagya engine de ka adwuma sɛ de sitie da bi biara no ho dendenden me ameyire o store no adi ni dwa me yire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanem papa ne mfia konkan ɔno nso complain da sɛ ho ba bia ne ya ɔsori anopa na no afanse kan ɔkonefu me akrobeto madwuma meye me kan news na me acte na me kɔbeba da biara no ebra me de bedampo na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se your secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a onomu a ebo nipadua no ema wosi pi wosita me kanfo ama wo se wonso no nom kowa mesa ni bi na baboa na aboa no abusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and at 0547 641 310. Say wo pe kwa mixture ato ewa America abrochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadie nkratuo yi agiatum se eye.
Yo, yasaba back to be so that they can you know. Aye health and wellness now. But fena do food na to one na wutie. And any Rosemont and I ever to drink combo. And I dey kan ho asem no dey it's all pa na obutie. Sexually transmitted diseases and infections. I can't want someone, no more yare. Yare, never them. And yes, I will die. No, I know. You put that. Now, I bet you. Now, Rose, and some of my call are many questions. You know, Johnny Woods, or the question be about, I think, a very important question. Or no, because HIV is not talked about like it used to be. Is it because there are less cases or a better medication for HIV?
Yeah, that's a good question. Yeah. That was a question, no. So yeah, I'm trying.
Just begin to, it makes me laugh.
So when it comes to HIV, it's actually twofold. So there has been studies showing that there is a decrease in terms of the level of contraction, especially in North America. And that's because of the amount of publicity when it comes to decrease in stigmatization, when it comes to easy access for people to understand more and to gain, to access and gain information quickly. Also, the PEP that I talked about, which is a prophylactic measure that is given. It's a medication, and that even does not necessarily need to be administered by a doctor. There's apps now that can be, people can actually get a hold of. In Canada, there's an app. I believe it's called Tony or something, and there's apps all throughout. Even if you go on the CDC. There's apps that people can get, and those in and of itself, again, reduces that stigmatization, reduces that level of fear that people sometimes have with seeking out medical advice or medical intervention on things. Let's say they're about to engage in sexual activity, they're going to even like they call them a bathhouse, or they're going to an area where they're uncomfortable with, but they know they're going to engage in sexual activity. They can get these kind of medications to them, and that can also protect them. So from a medication standpoint, yes, we do have a lot better drugs that help to subside the proliferation of the virus, as well as just on the front end when it comes to prevention. There's a more public health understanding and more of a increase in awareness as well as accessibility. So all of that together has decreased the amount of exposure and decreased the prevalence of people contracting HIV.
Can you also say the same thing for chlamydia, gonorrhea, and all these sexually transmitted diseases that you talked about? Because not a whole lot of people talk about these things.
Yeah.
You pretty much don't hear anything about them.
Mm-hmm. Yeah, so when it comes to chlamydia and gonorrhea, it's a little bit different. Chlamydia is still the most common type of infection, sexually transmitted infection that there is. Yes, it's not talked about a lot, but another reason why it's not talked about is because the treatment is so easy, and because the treatment is easy, most of the times people are able to get their hands on it, rather quickly, and then that's it. It dissipates after that. But the other thing about chlamydia and gonorrhea is that if it's not treated, then the complications become very difficult, especially as we talked about for women. And for instance, if a woman has pelvic inflammatory disease, usually when they have infertility, we're looking at different things. Pelvic inflammatory disease is one of them, but we're also looking at what's her menstrual cycle. Does she have signs of what we call PCOS? All of these other things as well too. So on kind of further down on the list is when we're thinking, oh, maybe it's actually because of chlamydia and gonorrhea that could have caused this. So because the treatment is easy, when it comes to the amount of advertising to decrease gonorrhea and chlamydia, it's not as much as HIV, because HIV is a systemic disease, a systemic type of infection leading to increased risk of death. Chlamydia and gonorrhea, not necessarily. So the amount of money and effort and advertisement put in towards chlamydia and gonorrhea is not as much as it was for HIV, as we know, especially back in the 80s and in the 90s.
Yeah, and to touch on that, so now other commercials that I see on TV, it's not to help you protect yourself or maybe prevent the HIV, but pretty much is the treatment.
Yeah.
Why has it changed from preventing yourself from getting it that to now that you're only promoting the treatment side?
Mm-hmm. Why is it that they're only promoting the treatment side for HIV?
Yeah.
Yeah, so I wouldn't say that they're only promoting the treatment side, because even from like commercials and even like when we're exposed and we're spoken to about how to increase the risk of awareness, prevention is still as important. And so, we do know about, so prevention looks a little bit different. Prevention is now not just condoms, but it is in that PrEP method now that is easily accessible. And then treatment as well too has become easier. They've reduced the amount of medications that is needed to be taken to just a few, to sometimes even one medication. And so that becomes easier and much more, it allows for people to want to participate and want to get into that as well, especially because they recognize that they can still have a good quality of life if they get the treatment and they get it early, as opposed to delaying that treatment.
Okay, well, let's come to the treatment. You mentioned that male circumcision is one of the prevention.
Yeah.
How is that possible? How does male circumcision prevent you from getting HIV? Also,
So
the disease.
Yeah, sexually transmitted disease is not necessarily HIV, but it does decrease the risk. And that's because what we do see is that when it comes to sexually transmitted infection, a lot of times it's in the foreskin of the penis. And so when that is removed, it does decrease the risk at times. So that's where the male circumcision comes in that sense. But most of the times it is carried through the semen. Right, that's how usually that bodily the bodily fluid is transmitted. But they do see that when it comes to general types of diseases, like for instance herpes, when it comes to gonorrhea, chlamydia, those things are decreased through male circumcisions.
Well, you're talking about bodily fluids. So when you say bodily fluids, do we include saliva?
Yeah, so saliva is an interesting one. So when it comes to saliva, usually a lot of times it doesn't necessarily transmit, but it does increase the risk in terms of, like with HIV sometimes. But mostly what we're referring to is semen, and we're referring to blood. Those are the ones that have the highest rates of actually transmitting. That's where a lot of times we are seeing the viruses and the bacteria really kind of dwelling in. And so that's where they had the highest rate of them transmitting, not as much as saliva.
Okay, so one, we're growing up, right, in Ghana, right, chlamydia was not even talked about. All we knew about was gonorrhea, right, and syphilis.
Yeah.
But so can you explain the difference between that chlamydia, because you're saying that is the most common one, right?
Yeah.
So can you give us the distinction between those two, and then because like I was mentioning, I didn't know that I didn't even know chlamydia. All I had was gonorrhea and syphilis and stuff like that.
Yeah, so actually there's not really much of a difference. That's why even when someone contracts gonorrhea, we usually treat chlamydia.
Okay.
They're like a downfall, like really, really close to downfall. So usually chlamydia too kind of comes with gonorrhea. So usually when someone has it, then we're also treating them for that as well. So the distinction is not that much different in terms of the presentation. It's still the same. It's the discharge that happens. It's also the burning sensation when it comes to urination. And for women also, sometimes another type of symptom is painful sex. And so they're not, in terms of the symptoms, they're not that much different. But when someone has chlamydia, usually we're not always treating for gonorrhea, but the opposite is not true. When someone has gonorrhea, we generally are also treating for gonorrhea, we're treating for chlamydia as well.
Okay, so I just want to put this in there.
Yeah.
That's exercising and keeping up with your health fitness. Does it stop you in any way from getting these sexually transmitted diseases? Does
it help you? So does exercising help? No, not in this case. It doesn't help. I mean, it could help maybe attract you towards someone, but no, it doesn't help because this is sexually transmitted diseases. It's not.
So diet, nothing helps?
No, so for sexually transmitted diseases, no. But when lifestyle, where does lifestyle become an aid? Lifestyle becomes an aid when we talk about things like Candida. Candida, because we know Candida is also connected to diabetes, because Candida is not a virus, nor is it a bacteria. Candida is from a fungus. And so fungus, they like, just like fungus, like, have you heard of athlete's foot?
Yeah.
So
you know, say I'm athlete into athlete foot.
Hey.
But the first crowd will be. That's the first crowd at this foot.
Dr. From Mitchell. So athlete's foot, it's the same thing. It's an infection of, it's from also yeast as well. So why do we call it athlete's foot? Because athletes usually, they, stay more longer in sweaty environments, right? And that's what the yeast, they like sweaty, wet environments. So if we talk about even staying active, let's say you go to the gym and you're not readily changing quickly, that can also increase the risk of making the environment favorable for infections, particularly yeast to grow. Same thing with sugar. Yeast grow in a sugary environment. And so because diabetes, when it's not well controlled, it does spill out into our urine, right? Then it increases the risk of infections, particularly, again, yeast infections, Candida growing. And so that's where lifestyle does play a role, because what we eat also can decrease the amount of glucose and the insulin that is needed to be produced, as well as our exercising also decreases decreases in terms of for glucose and for insulin, and then also the blood glucose that we look at, which is called hemoglobin A1C. That helps on terms of diabetes, which then can impact in terms of this fungal infection called Candida. So that's where that affects it. But specifically going back towards sexually transmitted infections, no, your exercising and your diet doesn't necessarily affect that directly. Someone said, can you please comment on the resistant strain that affects treatment outcomes? Okay.
I just want to read that. Can you please comment on resistant strains of infections and how that affects treatment outcomes?
Mm-hmm. Yeah, so that's
professional.
That's a good question, and it's important that we talk about this because usually a lot of the sexually transmitted infections are bacteria, so we are using antibiotics to treat them. And sometimes when we don't necessarily know what a type of infection someone has, we can do something called a broad spectrum type of approach, where we just treat with an antibiotic that is able to cover a lot. And then once we get the cultures back, we can tailor it towards what is specific towards that type of infection. But with that being said, it can increase the risk of having resistant strains like Dr. Ofori talked about. It's the same thing with kind of a little bit of what we're seeing now with the coronavirus and all the different strains that are happening in spite of us even with the vaccinations now. And so it's important that when it comes to treatment, it's important that you finish the course of treatment. So usually, sometimes the antibiotic regimen is either like a 5-day course, sometimes a 10-day course. It's important that you completely finish it. And because that will decrease the amount of resistance that comes. If we finish it in spite of even, let's say someone starts taking it, let's say they have a 7-day course, something like metronidazole, which is an antibiotic that's given. They do and it's given for 7 days. They start it. Let's say by day 3, they feel, oh, I'm good. I don't have any more of those symptoms. I can stop. If you stop before the 7-day course, you now increase the risk of having resistance of that bacteria towards that antibiotics. And so it's important that you finish it to completely decrease and to completely resolve that bacteria and resolve its growth. If we don't finish courses, we stop midway, we increase the risk of resistance, and then it becomes even difficult to actually treat it. Going back to another bacteria called bacterial vaginosis, there are people who end up having to have that treated several times. They get it like frequently in the course of a year and needing more and more kind of heavier measures to deal with that. That's because sometimes the way in which they are treating the infection is not always effective for the reappearance of that infection throughout the year.
Okay. My next question is that we talked about chlamydia, gonorrhea. So for gonorrhea and chlamydia, right? Mm-hmm. If it's not treated, I know HIV can kill you, so I'm not gonna go there. Can these two also kill you like HIV?
So that's a good question. So it can eventually lead to what we call disseminated gonorrhea or gonococcal infection. So when it's disseminated, so that means like disseminated means like a full-on spread, right, throughout the entire body. So if that happens, that can lead to something called sepsis. Sepsis is bacteria that now is in the blood system, right, in the circulatory system. And that increases the risk of someone dying. Because now you have infection, not just in a contained portion of your body, not just, let's say, in the reproductive tract, right? But now throughout the whole body. So that can cause sepsis, that can lead to cardiac failure, right? Because now you're affecting the blood and the circulatory system throughout the whole body, and that can increase your risk of mortality, death.
Okay, I've heard that, I think recently I heard that they have like medication, or medicine that you can take that will cure you from HIV or AIDS? Is it something that is true?
Yeah, so that's what our research is trying to push towards, is the actual cure of AIDS. There has been a strain that has been proven to be more of a curative type of strain, but it is not found in everyone who contracts HIV. So that is the goal towards. But right now we're getting closer than we were, 20 years ago, even, or even 30 years ago. We are getting closer, but still, there is not yet a medication that can completely cure, but it can decrease the amount of replication of that virus and affecting the immune system completely.
Okay. So I heard that there was some, sex workers somewhere in Africa, someplace. They were the HIV carrier, right? But they were not getting the AIDS, which is the disease. And they were actually spreading it out. Can you speak more into that?
Yeah. So again, if I don't know the story, but assuming that they were on medication,
Those
right?
people were not. Obviously, they were not on any medication.
Yeah.
Okay, so they were not on any
So
medication.
my question is, do we have like asymptomatic HIV patients like we have for coronavirus?
Magic Johnson.
Yeah. And remember, there is a 4 to 7 year asymptomatic period,
Okay.
right? So one can start off with symptoms, right? And then, so it's just, again, it's a very, they used to call it the great mimicker, right? HIV, because first someone just gets a general cold. They just get fevers, and it's a low grade fever. It's not something that's completely wiping them out. I just noticed that they're getting fevers. They get a little bit of night sweats, some chills. They get maybe like a lymph node that's swollen in the neck, and then it goes away, or they get the cold. It takes a little bit longer, but then it goes away. And then you have a 4 to 7 year incubation period where they're asymptomatic, right? But they still can transmit the disease. They still can transmit the virus, but they're not showing anything, right? So that's possibly what they could have had at that period, where they weren't showing anything and they were still active in this kind of workforce, so sexual work, but still causing other people to contract the virus.
Okay.
Is that what you heard?
Yeah, I think my question is, can someone have HIV without having AIDS?
Yes.
Absolutely.
Yeah, they can.
And how is that possible? Because we know that the HIV develops into AIDS, right?
Mm-hmm.
So how is that possible?
And you're saying that person is not on a medication, right?
Yeah, you're not going to be on medication or anything. You just have the HIV. They didn't even know that they had the HIV.
Mm-hmm.
They didn't fall sick. They didn't have no symptoms, nothing.
Mm-hmm.
They're just regular people, but then they had the HIV in them that they were also transmitting to other people.
Mm-hmm, mm-hmm. Yeah, so you can have that period of being asymptomatic and still with HIV. So what's the determination between HIV and AIDS is when it completely affects the immune system to the point where what we call the CD4 count is about 200. Right, so it gets to really, really low. What does all of that mean? So in our immune system, we have cells. Particularly, we have one cell called the CD4. It's a particular type of immune cell that helps to fight against any kind of infection that you have, whether it be bacterial, virus, fungal, from like a protozoa, and any kind of random thing that our bodies are always exposed to, but we don't always present with symptoms against those things. But when our immune cells are completely compromised, right, that's essentially what AIDS is when our immune system is compromised. So then all of a sudden, this person, the littlest thing, they're getting sick. They even go to, let's say, for instance, if you go to the desert areas of the US, so places like Arizona, all of a sudden there's an increased risk of having something called histoplasmosis. It's a type of peculiar pathogen that increases the risk of having a lung type of infection. usually when people who are immunocompetent, that have a good immune system, when they go to places like this, they're fine. But for people who have AIDS, who transition now into AIDS, the littlest place that they go, they can increase the risk of having a full-blown type of infection and causing severe complications, and even lung disease, lung cancers, and cancers of the body as well. So that's what can happen and causes AIDS. But not everyone who does have HIV quickly jumps into AIDS. It does take a long period of time. And sometimes it's in an incubation stage where they don't necessarily develop into AIDS.
So yeah, let me add something to that.
Yeah.
So there's a particular group in Africa that, when it comes to transmission, right? You have replication, and then you have like infection of the cells.
Okay.
So you can produce more, like the coronavirus, right? You can produce more viral particles, but it has to infect the cells, especially the immune cells. So when it comes to drug development, we look at like ARHWS, they prevent the entry. You're from entrance inhibitors. So in order for the virus not to go into the cell, and I saw then a target DB, right, to get in there. There are certain group of people, other places are more genetic defect. Reduce that transmission. Into a bit longer time for that we need replication and numbers no cost. So those kind of group in the story now they realize that genetically they had that change, M transmitted higher, right? Into more some defense mechanism. But again, as they age, when they're exposed to this without treatment, they eventually succumb to one of these opportunistic infections.
Okay, thank you, Dr. Frey, producer / EIE.
Yes, thank you.
So I just want to have this clarity that so HIV, I mean the AIDS actually doesn't kill you, but then it compromises your immune system, and then like hey. That's what happens, right?
Yeah.
Okay.
That's pretty much.
It's right? And then at that point, you are just defenseless.
Yes.
Any disease can come in, and that's what actually kills you.
Yes.
Okay.
So that's where I don't know if you heard like before when HIV was or AIDS was really rampant, they would say like, oh, this person died from a common cold. Like that was kind of the story, that was the narrative that was being shared at that time. And there is some truth to that in the sense that any little opportunistic, as Dr. Fori said, any kind of opportunistic infection can potentially kill them. And something that like our bodies could easily be able to fight against, it no longer has that defense mechanism. Right, so the whole that fighting protection, that barrier is now broken, and so now yes, anything can come and actually cause infection and mortality, death.
Let's talk about anal sex. I heard that contribute that actually increases your risk of having HIV or maybe sexually transmitted disease. As compared to the regular sex. When I say regular, you know what I mean. So is there any truth to that?
Yes. So there is. Anal sex does increase the risk of transmitting HIV, and that's why we do see it more so, particularly in groups we call them MSM, right? Men who have sex with men. Because usually that's the kind of sexual activity that they practice, right, and engage in. And that's also because there's the anus has a very rich blood supply, and we know that HIV.
You can read it, but
we know that HIV, one of the bodily fluids that it goes through is through semen and also through the blood. Right. So when there's a very rich blood supply and there is that forceful interaction, it also can rip, right? It also can cause there to be barriers, or not barriers, but it can also compromise the barrier system in a sense. And so for that reason, it increases the risk of them being able to contract HIV. Does that make sense?
Yeah, it does. So that is a reason why in the I would say in the LGBT community, that is why the prevalence is a little bit high, right?
Exactly. Yeah.
Okay. Well, so Johnny Woods, your question has been answered. He was asking why do we have is it common in the gay community? HIV. So I think that is the reason why, right?
Yeah, definitely. Okay. Definitely for that reason.
All right. So let's go for a quick commercial break, right? When we come back, then we try to wrap up the show, and then we see sometime. So let's go for a quick commercial break, and then we'll be back.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663. Massachusetts Foreign Transmittal License, FT1179663.
World Wow! Me pa na fi ma file me tax CHLAMYDIA kwa mami. Na ene se afenua kwawe me tax file na beye me asompidie ene nkwadana. Nanso with acronym and associate se die menyo butantim e me tax issues ahodio nyina mu. Onua wow ene sen e wo se file o tax with smile. IRS for editable atoso. Womu hunehuna, womu tata, wo file o taxa. Dapia da uboka, usika unya ekituebi. Make no mistake. Fahobo acronym and associates. With acronym and associates, what tax filing ebedano S gracia ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing, and NSM, acronym and associates. State BIA Iowa America, Kroponimono, Mepacho, Womu Ewo, GDA, Anamon Quine, Pasua, Wombetime True, Akoshem Quan, Ewo, tax filing. Ain't baby Bia Ubia, Utimi, any acronym and associates etokese na juma dia obonti acronym and associates e deal bia the friends owura gender na chese wakodare mu aben e wo tax filing fa wo bedan wo mo hwehwe wona chi kwan e wo offices ahodoa edidi suwe. First location 684 West Boughton Road, Suite 201, Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre opani kwanchafo no ewo telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-247-3454. I feel bit my email no akunim.info@gmail.com. Akunim and associate, yes, nukrenie open kunim die tax mudia. This is what took us with akunim and associate. ANG nkwa.
Miniaba eni ma medufi oye dwuma odukasi anopa biara miniaba sori ahoɔden mu na ɔkwadwuma on complaining da sɛ ho ba bitutu no sanso na mebra o efitani o tu engine na o pagya engine de ka adwuma sɛ de sitie da bibiara no ho dendenden me ameyire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanem papa ne mfia konkan ɔno nso complaining da sɛ ho ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meye me kan news na me acte na me kɔbeba da biara no ebra me de bedam na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se your secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a onomu a ebo nipadua no ema wo si pi wo sita me kanfo ama wo se won so no kowa mesha ni bi na baboa na aboa no abusua na yare da ho eya nunum bi na obedi adanse wo benya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and at 0547 641 310. So we'll pay kwa mixture ato ewa America bruchi memua called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadie nkratuo yi agiatum se eye.
Yo, yes, I'm akwaba bio at the bar alcohol ready so. So I feel now do a feed na to one yes, we have to say a lot because we are kabebrebe. Is any bania be rapping up. Sexually transmitted diseases and illnesses. Infections in our account. I don't want some like I name Rose no na drink come. Rose, think say yeah do it yeah be rapping up. And my name is Abia something specific you want to stress on and Sunday the show ya banner.
Yes, so thank you again, sir, for the invitation to come in and speak in spite of my tree.
I treated it as my catch say Obia what wako Ghana so da kusunti.
Oh, who was that?
I'm PC. Eh?
Oh, me to papa so. Oh.
I move a girl. A whole man about Quabetum.
But for me, Mr. Woodia, Mama, who time now? Who time now?
Come on, cause I'm not coronavirus in your mind. I cry.
Oh, who's that?
It's a time where the Amawan, I'm saying, I don't know you.
Oh no, sir, me pese like I think sir the treatment sir me call Ghana biom. Who's that? Nah.
So Ghana, yeah.
I na tree no ever to throw kama sen kwine. But I wanted to say thank you, Midawasipi, for invitation on that. To just be able to speak on this topic. And I think with everything that has been said.
Yeah, I just wanted to address this question and then we can get it over with. Johnny Woods wants you to tell us how we can, discourage people in Africa from believing one drug cures all diseases, including HIV. So now what kind of Oko Ghana, Adrobako, Esa Koko, Esa Mankeni, Esa Bayere, Esa Banchi. Esa body, esa ya bia adroba akope. Esi who is a crab besa ebetu ase. I mean, hygiene. Those things, they are not hygiene. And also, talk more about it, and then try to see if we can discourage people from, doing those things.
Yeah, so a tier four, that's a really good question about how do we discourage, because it's not just one drug that ebetumia cure everything. That's because the source of the different diseases that we have is not through one thing.
Yeah.
Right. We have diseases that come through multiple different things. And so it makes sense for us to be able to treat it.
Some diseases go more a virus,
yes,
bacteria.
Bacterial.
How do you treat
one thing to treat all of these different things that come from different sources? And to me, yeah, like that's not that's not the way to go about it. So we have to, if we're trying to treat something, we have to treat it from its source, right? So if it's a viral kind, and that's even just a little side note, people end up getting, like, let's say, an infection. And I see this readily where someone gets an infection, it's most likely a viral type of, let's say, even a cough, right? It's a viral cough. It's not COVID, but it's a viral cough. And chinchna per se, doctor no prescribe antibiotics for them, right? And that actually goes back to Dr. Fori's question, which is how do we decrease the amount of resistance? That's actually one of the biggest things that's causing resistance to a lot of the bacteria and a lot of the kind of infections that we're noticing in people, because we are being forced to treat them in a way that does not consist with how it actually happened. So people want to be treated with an antibiotic for a viral infection. It's not going to work, and it increases the amount of resistance that happens. So when it comes to, even in this case, about, how do we discourage people from thinking that one drug will cure all? It's things like this. It's not one thing that will, because one drug is not able to address different sources of different ailments or different diseases that happen. So it's important one thing I want to leave with everyone listening at Tier 4, that we do our due diligence to, also get involved in preventative health. I don't see a lot of for that we go towards healthcare. We go seeking our doctors for preventative health. I see a lot more, let's say, different cultures that are willing to come for their daily, their routine screenings when it comes to preventative health. But I'm not really seeing our own people coming for that. They'll come for treatments when things have really gotten worse, when things have progressed to, sometimes a worse state. That's when they want to now get the treatment. But when it comes to the routine preventative health, they're not necessarily doing that. So I want to encourage everyone to do that. Take a preventative measure when it comes to your health. So even if you're going to engage in sexual activity, make sure you are protecting yourself. You're using condoms. You're also asking that person that you're with, do you have a history of sexually transmitted infections? Have you had that? That also helps in terms of that prevention as well, decreasing the amount of sexual partners that you have as well. Being in a monogamous, committed relationship, if you're not married, waiting until you get into a committed relationship. All of those things are different measures that we could take as decisions that we make to help and ensure that our health is being preserved, as well as also taking measures to treat the necessary causes of what we are seeing symptoms of.
All right. Thank you so much. Thank you so much. It's been a blessing having you back. And, hopefully, the next time we come to you, you might have gone back to Ghana, and then
it'll be smoother. Between a year.
About your own. I see. I'm going to see the more. He's a one-word man. And then in the post or comments on there, just one word. Or started from boy. Ayeka. Eish. Yo. Why? No, I the boy. I try to.
Oh.
From boy to boy.
Boy.
I consider more than one word. I just boy all right, you thank you so much. I say for Hanuman Abraham, I'll climb here, and right after I show you in the pause, the host himself, I consider more, and then the crew, no, Dr. Yinsu, and of course, the Kizito producer, Dr. Forrest, so I have a much done. You free how more eba, and I think so right after almost so no OBG Ghana series, OBG series. I'm almost the Jumadi about twice. And see, more video no na ha, man free uncle baby. The Hanuman out the tour action in the war. Was a World Cup, no, draw no Abba until I got cinnamon and Crawford. How many rules to crack and I was a Canada, so I qualify. And I'm hey, Canada qualified to Canada in team, but to me, I will properly. Some more moko be a bear. I have a movement. Movement. Some guys are in Africa for you. Mohammed is so you're watching that Mohammed at Tung Kache. I told Gaje Pa Mohammed's corner. I for the cost of Ghana brain. I know that there's a lot of things going on in Ghana and tea. Or more than a friend in our brain. And a Rosemont, we thank you so much. And for Hannah Bremer connected more than in our back. And I must be number next week, same time. And the back. And I must be